Now, a rare COVID-related illness called multisystem inflammatory syndrome in children still has medical experts puzzled tonight. Channel 3's Waterbury Bureau Chief Dennis Valera explains what we now know about MIS-C and what local research is being done to better understand it.
The first cases started coming in Connecticut Children's last April.
These were kids that were coming in with very high fever, with an unexplained illness, and when we saw them, we figured this could be related to COVID-19.
To date, Connecticut Children's has admitted 115 patients with COVID-19 or multisystem inflammatory syndrome in children, or MIS-C. A CDC study finds the average age of a child diagnosed with MIS-C is 8. Dr. Juan Salazar, physician-in-chief, says doctors still don't know exactly what causes it, but it appears in children weeks after COVID-19 infection. Symptoms include stomach pain, rash, fever, also hand and feet swelling. It generally lasts for 1 to 2 weeks, but some patients are known to take a month to fully recover. How often it occurs is up for debate, but Dr. Salazar says it's likely less than 1% of all COVID-19 cases.
We need to study it. We need to understand if there are any long-term heart issues. We need to understand if there are any long-term learning issues, cognitive issues, and that's something that we need to look at in kids.
MIS-C has been compared to another condition, Kawasaki disease. The symptoms are very similar and it seems to be triggered by an infectious disease. But Dr. Salazar says its exact cause is unknown as well. He hopes COVID-19 and MIS-C can help lead to an answer.
A lot of insights that are coming out of this new infection that will give us insights about what's been going on in kids for the past 40 years in a disease that we call Kawasaki.
Dr. Salazar could get that answer soon. The National Institutes of Health awarded him and 8 others nationwide $20 million to study MIS-C. With his funds, he is working to develop technology that could detect MIS-C and Kawasaki quickly, just with the patient's saliva. Down the road, when we do know more about these conditions, the chip could help doctors start tailored treatments more quickly.
1 by 1 centimeter chip.
Say a child with MIS-C symptoms comes to the ER. If this chip works the way they want it to, Dr. Salazar says that they will be able to detect if the child has MIS-C, Kawasaki disease, or another viral disease within a half hour to an hour of that child's arrival.
So far, 50 kids are enrolled in the study. A number of labs are collaborating with Connecticut Children's on this, including some researchers from the country of Colombia. The NIH funding will last for 4 years. In Hartford, Dennis Valera, Channel 3 Eyewitness News.